Great. Hey, thank you very much, Taylor. Thank you all for joining us for this press briefing. And once again, I am still in quarantine here after a close contact last weekend. So appreciate everybody's patience as we do this via Zoom. Today we are joined, we're very excited to be joined by Frank Bisignano, who's the CEO of Fiserv. And want to really talk about Frank and the companies because he's really had a fantastic career. First of all, as you all may know, Frank was the chairman and CEO of First Data. First Data was a company that has been in Nebraska for 50 years, a leader in the financial services industry, and they were merged together with Fiserv back in July 2019. Frank is the new CEO of the combined entity, and this is just a great organization where for 8 years in a row now, they've been listed as one of the world's most admired companies by Forbes. They're listed as one of the #1 for the management of their people. And Frank himself has had a fantastic career, obviously as chairman and CEO of First Data, really making that a leader in the financial services industry. But also prior to that, for example, he was the person who worked on moving JP Morgan after the 9/11 attacks and really turning around their mortgage business there. At Fiserv, they've worked to be innovative through this pandemic. One of the things that Frank did for his Omaha workforce was to increase the pay of the people who are coming in. We were talking about that a little bit earlier, to really show the appreciation for the folks who are making things happen at First Data and Fiserv. And then also with the PPP program, launching innovative tools to help banks be able to serve customers. And certainly, here in Nebraska, we were one of the states that was one of the highest ranked on a per capita basis of our companies working with our banks to be able to get that PPP money and help them stay in business here through this pandemic. One other thing that I want to mention is that Frank has been a consistent advocate for veterans. You may know that Ed Toner, who worked at First Data, told me that when Frank was there, he was always talking about how to hire veterans, how to help veterans. And here in Nebraska, one of our goals is to become the most veteran and military family-friendly states in the country. And so I really appreciate the work that Frank does to be able to help take care of our veterans. We're very excited with Frank having an announcement today. So with that, I'm going to go ahead and turn it over to Frank to talk a little bit about Fiserv here in Nebraska.
Thank you, Governor. And I'm sorry that you have to quarantine, but as we all know, safety first in this day and age, and I'm glad to see you're well. And it's my honor to be here with you and with the state of Nebraska. Way before myself was the Fiserv roots in Nebraska, both in Lincoln and in Omaha. And I've found myself in Nebraska a lot over the years. It's been a great place for our talent. Our relationship with the state, with the universities, with the local communities has always been very, very large. And as we go on our journey to be the greatest fintech in the world, we see Nebraska as a strategic location for us in the go-forward plans. And our ability to attract and retain talent, our ability to invest in our people, we think is very good in Nebraska. And I think it is a fabulous climate for businesses to operate. The leadership has always been warm to us growing in Nebraska. And it's the home for, over 5,000 of our employees, a large part of our U.S. workforce. We will continue to invest in our people. We will continue to invest with the university and the local communities. And I think we're fortunate to have such a great set of talent. People are our #1 asset. We're in a people business. We're technologists. We build technology. We serve financial services in all markets. and all client types. But the most important thing is our people, and they've demonstrated their resiliency. We've had thousands of people come into the office and do what we consider our essential workers. And to that, I've always been so thankful to the workforce in Omaha and in Nebraska and in Lincoln. So I think Nebraska and Fiserv have the same value system, the same aspirations. I'd like to thank you personally, Pete, for your leadership. I'd like to thank your whole team in Nebraska. I'd also like to thank the business community in Nebraska because, you know, they have been fabulous in helping us go forward. And each and every one, and the mayors of the cities we operate in have always been good partners. So I thank each and every one of you. It's an honor to have this virtual meeting. I look forward to our physical presence again in the same room. I am looking forward to the College World Series, hopefully. And thank you for taking the time out today for us. And thank you for what Nebraska does for us. And we want to do more for Nebraska.
Great. Well, hey, thanks very much, Frank. I appreciate it. We're obviously very grateful for the jobs that you have. We look forward to working with you to help you grow your presence here in Nebraska. Obviously, we think we got a great workforce here. Certainly, you know, when I was in Ameritrade, I will tell you that, as you know, Nebraskans are well educated. They got a great work ethic. They're customer oriented, they're loyal, and they help companies succeed. And we look forward to helping you continue to succeed here in Nebraska and all across the world. So thanks very much for joining us here today. And again, we're very grateful for your investment in Nebraska and look forward to our continued partnership.
Thank you.
Great. Thanks a lot, Frank.
Have a great day.
Yep,
appreciate it.
All right. So I think Frank is going to be dropping off here now, and I'll be, yep, all right, good, yep, he's dropping off, but hopefully we'll see him back here for the College World Series. And now we'll go over some of the typical stuff we typically do in the press conference, then we'll go over to Angie Ling for a vaccine update. As always, we want to remind people that obviously the fact that quarantining your home is a demonstration we still have a pandemic going on in our state. I did test negative yesterday, which was day 5. So per our quarantine protocols, I will be able to leave my house with a mask starting on Sunday. So that'll be 7 days after my close contact. So I'll be able to do that because of the negative test that I had from yesterday from Test Nebraska. So that's good news there that I don't have it. So appreciate everybody who's helped out with that. And Test Nebraska, they did a great job. I actually got tested twice this week, and both times it was very, very slick. And also just want to remind people that because we're still in a pandemic, please continue to follow the protocols we've set out, you know, use the tools we've given everybody. Please make sure you keep your 6 foot of distance between you and other people when you're out in public. Wear a mask when you go to the store, wash your hands often. That actually kills the virus. And again, please, if you have those symptoms, cough, fever, you've lost your sense of taste and smell, please stay home. We don't want you spreading the virus. Those may be signs that you've got the coronavirus. So stay home. Test Nebraska is a great way to go find out if you've got coronavirus. If not, it may just be the regular flu or something, but we really need you to test and find out so that you're not spreading that to other people, because we know coronavirus is very transmissible. And there are new variants that are even more transmissible that are have been identified now as close as states like Iowa and Colorado. So please, everybody, continue to be vigilant with regard to using the tools to be able to slow the spread of the virus. Avoid the 3 C's, you know, those crowded places, confined spaces, close contact, keep good ventilation. All those sort of things will help us to be able to slow the spread of virus here in the state of Nebraska. Our hospital capacity is what we're looking to protect here. That remains very robust at 31% of our hospital beds being available, 35% of our ICU beds available, and 80% of our ventilators available. As of yesterday, we had 278 hospitalizations And I believe that just got updated today to 285, but we're still about 7%, which is where we were maybe like the first week of October. So hospitalizations are down, which is good news, but we want to continue to see those hospitalizations go down to the point, we're, getting down to the levels where we were in September or the summer last year. So everybody can be a part of that by slowing the spread of the virus. And of course, Test Nebraska is still available, testnebraska.com. It's easy to use. Go sign up. You'll be able to go start scheduling for an appointment. Again, I used it twice this week. It was very, very easy. So please use testnebraska.com. Now, with regard to our vaccinations, obviously that's one of the key things we're doing to fight the pandemic. And we've got some good news with regard to vaccinations that Angie Ling, our incident commander for the Department of Health and Human Services, is going to be able to share with you today. I'm going to steal a little bit of her thunder. We have been getting more vaccine from Moderna. I was on a phone call yesterday with the CEO of Pfizer, Dr. Borla, and we believe that we'll be getting more vaccines from Pfizer as well later this month. So that's good news. And that we'll be getting a very steady stream of vaccines from Pfizer, which is something that is important for us in our planning. And then obviously yesterday we got the news that Johnson & Johnson had submitted their documentation to the FDA for their emergency use authorization for their vaccine, which means that potentially later this month we could see an additional stream of vaccines coming in from Johnson & Johnson, which is also good news. So a lot of good news on the vaccine front. We do have our scorecard that's on our vaccine information page. What we do is we set the allocation at the beginning of the week for what we receive, and then we'll keep track of how many doses we've administered out of that. And so far, we're at 97% of our first doses being administered, which is very good news. And it's a great credit to the work that our local health departments are doing to be able to get vaccines in people's arms as quickly as possible. All of our health departments are in phase 1B now, which means that they are focusing on folks who are older. Generally we've said 65 or older, but health departments have flexibility to start at older folks. So for example, in Central Health District, last week they were doing 90 years old. This week they're doing 80 years old. Douglas County is doing 75 years old. So you can see that's how some of the health departments are managing it to be able to make sure we're getting to those older folks first who are going to be more at risk. So with that, I'm going to go ahead and call up Angie Ling, who is our incident commander for the Department of Health and Human Services. So Angie, you want to come up and talk a little bit about what we got going on and give us some specific numbers with regard to vaccines and how that's all progressing?
Sure. Thank you, Governor. Good morning. As you can see on the dashboard, February 4th was a record high of 14,231 doses administered, and we plan to keep this momentum moving forward. This week, we received 11,700 Pfizer primary doses and 15,500 Moderna primary doses. Next week, we are expecting 11,700 doses of Pfizer primary doses and 17,000 Moderna primary doses. And we expect to receive this quantity each week moving forward for the next 3 weeks. Each week, we're also receiving approximately 23,500 second doses, and as the weeks continue, that number will go higher to mimic the schedule that we're on. As I mentioned last week, we're working closely with the Long-Term Care Federal Pharmacy Program to get their extra doses into the state's allocation. CVS returned 5,850 doses this week, and we will receive 11,700 total doses from Walgreens that will be over the next 3 weeks to ensure we have proper first and second doses. The federal retail pharmacy program is set to start in Nebraska next week. We have not received a list from our federal partners as of yet, but do anticipate it no later than early next week. The pharmacies for Nebraska that are participating in this program for the early stages will be select Walmart pharmacies and then locally owned pharmacies that fall under the distributors of AmerisourceBergen Drug Company and Cardinal Health organizations. We will keep you informed of what pharmacies are participating as our federal partners inform us at the state. Just a reminder, too, that is, they work directly with the pharmacies. So the pharmacies and CDC work together, and then they inform us of how that's going to work. Another reminder is that this is additional product coming into the state. This is not pulling from our state's allocation, and it will be based on a population-based allocation. So there's supposed to be 1 million doses nationwide, and we'll get a portion of that based on our population. And we will be receiving that data soon as well. Also, we're working closely with FEMA and NEMA this week, and we will be submitting a plan in the coming days for additional support. At this time, we're asking for funding so we can support that or source that support locally. No additional bodies will be coming in from outside the state. We're happy to see all the photos and stories of those sharing their vaccine experiences and really giving hope to our most vulnerable populations. A good shout out to some of our local health departments who are doing mass vaccination sites. Yesterday, the Grand Island area was able to do about 1,000 folks, get them vaccinated at the state fairgrounds. Today, there's going to be approximately 4,500 vaccines administered to those vulnerable populations at the Pinnacle Arena here in Lincoln. And we have multiple sites in Douglas supporting numbers up to the thousands, so 700 to about 2,500 at one time. So we have, and that's just some of them. So lots of encouraging stories moving forward, and I really think we're going to see our numbers continue to increase. On the scorecard, as the governor had mentioned, we do update the allocations coming into the state on a weekly basis. So on Sunday, we updated all the numbers that we were receiving that we can use against as of Sunday. And so you can see that we're really working on that first dose with 97% of what was received has been administered. And so we usually receive those doses in for this week on a Monday, Tuesday, Wednesday, and you can see how quickly those health departments are getting those doses and they're really starting to move on them. We're also want to encourage everyone, if you did receive your first dose, we want you to come back and receive your second dose. We are seeing a slight lag in folks not coming back for their second doses. So please ensure if you got your first dose that you are coming back. We have a dose for you. So we want to make sure that you are fully inoculated. Those are my updates for today. We are excited about the coming weeks as I think our vaccine program will really be growing. Thank you.
So, Angie, before you leave the podium there, one of the things, could you just address, because I know we're going to get questions about, is just how is that, just make sure we're being clear, there's a difference between the long-term care federal pharmacy program and this new federal pharmacy program that is going to be starting next week. And then talk a little bit about how people will be able to get vaccinated through the new federal pharmacy program that's starting next week.
Sure. So a lot of those details are still waiting to be told to us, but the long-term care federal pharmacy program involves CVS, Walgreens, and community pharmacy. And doses were allocated to them specifically so they could go into the long-term care facilities, so skilled nursing facilities, assisted nursing facilities, and now they're working on the independent living facilities. And they're going in and vaccinating those staff and residents. The retail pharmacy program is different because that is going to be that vaccine at the pharmacy. We are anticipating that they will most likely be using their own scheduling system. However, the state system will be available to them if they opt to choose that. But that is how we're expecting that once the list is confirmed by the federal government, that they will put that information out, that they are available to schedule. They do follow our phases, so they will be working in the 65 and older population just like we are. They will also be able to assist with some of the phase 1 folks that if there's new hires in healthcare, et cetera, they can go and get vaccinated in these locations as well. So I think we're going to have a lot of details coming in today and Monday to be able to give out, and we will push those details as soon as we have them.
Great. Thank you very much, Angie. All right, with that, Taylor, I think you've got some questions that were submitted ahead of time, so why don't we get into questions and answers?
So the first question comes from Paul Hamill at the Omaha World Herald. He would like you to comment on concerns that your transfer of money into the cash reserve to trigger additional income tax credits under LB 1107 circumvents the intent of the bill, which was to provide extra credits when growth in state revenue exceeds 3.5%. He wants to know if this is creating artificial growth and will it harm other state spending priorities.
So what Paul is asking about is a recommendation that we made in our budget to move money into the cash reserve in this fiscal year in anticipation of the excess revenues that we are having. So our revenue's been running above forecast for just about every month this year. And what that means by operational law is at the end of the fiscal year, which is June 30th, that will all get moved into the cash reserve. And actually, I believe what we're doing is in line, in fact, supports the intent of the legislation 1107, because the intent of that legislation was to pay additional property tax relief should our state revenues run ahead of forecast. However, the way the bill was written, if it was based on that June 30th date, but typically we don't make those transfers to the cash reserve till about July 15th. So if the bill had been just written so that they check them, the reserves, what the cash reserves were at on July 15th, we would be well in excess of that threshold to provide additional property tax relief. So what we're doing is actually 100% in the spirit of the intent of the legislation to be able to provide more property tax relief. So I think it's just the opposite of what Paul is talking about there. And I should also note that in the two-year budget recommendation that I have, not only are we supporting the additional property tax relief, but have left over $40 million for the floor to work on their legislative priorities, as well as funding the additional legislative priorities, such as the rural broadband initiative, to help make sure we're connecting those 80,000 unserved Nebraskans who don't even have that 25.3 download speed to be able to get broadband access. So we're funding all the things that we need to do with regard to state government. It's all there in the budget, and we're providing that additional property tax relief. So it actually is in line with the intent and actually funds all the services that we have here, including fully funding the state aid to education formula.
Our next question comes from Andrew Ozaki. He wants to know, the St. Francis executive overseeing the Nebraska's child welfare case management has taken another position with St. Francis. Do you know why that may be, and should this be another concern?
So with regard to Andrew's question with regard to an executive who oversaw the case management taking a different position within St. Francis, at the end of the day, we're holding St. Francis accountable for delivering on the terms of the contract that we just renegotiated with them, and that's what we'll focus on. So they may have their own internal management moves, but we're going to be focused on making sure we take care of families here in Nebraska and making sure that St. Francis is delivering on their contract obligations to do so.
Andrew's next questions are for Angie, and I think she may have answered some of these in part already. He's asking, when did Nebraska sign up for the federal retail pharmacy program? What pharmacies are under ABC and Cardinal? And if you've already registered for the vaccine, do you have to sign up at the local Walmart or a drugstore under this program? And how do we make this less confusing for people? So if you want to just come comment on these, Angie, that'd be great.
Sure. So I think I answered most of those, but because we don't have the list from the federal partners yet, we haven't been able to work with the individual pharmacies. So once we get that list, we will be working with them to determine how the information sharing for the registration system that we have and how we can share that information and how we can work together as partners. So that's probably the biggest thing. And then once we have the information, we'll be able to present a much more organized approach to this retail pharmacy program. So more information to come, and we plan to work closely with that retail pharmacies that are selected for this program.
And I'll just read this next question,
Okay.
which is for you,
Go ahead.
if you want to repeat it. Grant wants to know, what does Angie mean by a slight lag in people coming for second doses, and can you quantify that?
Sure. So the question was about the slight lag in the second doses and to quantify how many people have not come for second doses. And the numbers show we pulled numbers on how many people have not returned within their proper period plus their grace period, which is a 4-day grace period recommended by the CDC. And right now it's about 6,000 people have not returned for their second doses. So we're really hoping that people will come back for their second doses. It is mentioned by the CDC, though, that they can come back within 42 days, so they do have some time. We do know that people have reached out to us about travel considerations and such, so we are working closely with those folks that reach out to us.
Jeff Robb also wants to know, do you have a number on how many doses Nebraska will receive through the new pharmacy program?
So the question was, do we have a number on how many doses will be received through the new pharmacy program? And we do not. We have no expectation at this point. So I will get that number to you as soon as we have it.
Our next question for you, Governor, is from Grant Schulte. Does the governor support the motion by some county GOP activists to censure Senator Ben Sasse? What do you say to party folks who argue that Senator Sasse used party resources to run for election, but doesn't want to support the party's chosen nominee?
Well, first of all, I would say that let's remind everybody that Senator Sasse has one of the most conservative voting records in the U.S. Senate. So he has been somebody who has supported conservative causes with his votes on the floor there. I would say that I have heard a lot of frustration from a lot of people with regard to not Senator Sasse's initially voting record, but what he's been doing with regard to the previous Trump administration and so forth. And what I would encourage people to do is that they should reach out directly to Senator Sasse and have a dialogue. I think a dialogue is going to be a better approach, with regard to our party and everything like that. So that's what I would encourage people to do.
Jeff Robb from the World Herald would like to know, when do we expect the state will finish vaccinating the 65+ age groups, and do we know what comes next?
So with regard to the age 65-year-old age group, again, if we're talking that group generally in phase 1B, I think we've kind of covered this. We think there's probably 500,000 people there, probably about 400,000 people will want the vaccine. And so how fast it takes us to get through that is really going to be dependent on how much vaccine we get. As Andrew was laying out, we are seeing increased numbers of vaccines. If we see more vaccine, we'll be able to get through it more quickly. If we can get other vaccines in line, like the Johnson & Johnson, that will help out even more. So, we are thinking it's going to take, at least a few months here to be able to make sure we get through that opportunity. But a lot will depend on how much vaccine we get.
Brandon, did you have any questions for the governor or Angie?
I guess following up on the Sasse comment, do you feel the GOP is going in the right direction following how Trump's been going, or should the GOP veer a different way?
So Brandon's question was following up on the comment regarding Senator Sasse. Do you feel like the GOP is going in the right direction, or should they be headed in a different direction after Trump?
Well, I think one of the things that we as the GOP need to do is make sure that we're reaching out to voters and talking about how we're going to benefit them in their lives, how we're going to benefit them, their families, their communities. I think if you look at the Trump administration's policies with regard to trade, for example, making sure we have fair trade, that we're not having a playing field that advantages other countries versus our own workers, that's important. We got to have security. The President Trump was very hard on our enemies overseas and making sure we were secure here at home. He was in favor of energy policies that reduce the energy costs for families all across this country. I think those are the things, the types of policies that we as the GOP need to continue to pursue to be able to attract voters and really help them understand how our policies are going to benefit them in their everyday lives. So I think that's what we have to do as Republicans. As always, we have to go out there and make the case for why our candidates are going to benefit the American people.
Any other questions, Brandon? No. All right. That's all the questions we have, Governor. I'll turn it back to you for any closing comments.
Great, thank you very much. Before we wrap up here, I do want to, again, let everybody know about the schedule for next week. I will be testifying in front of the the Transportation and Telecommunications Committee next week on LB 388. That is our proposal to invest $20 million in each of the next 2 years in expanding rural broadband. We do, as I mentioned earlier, have 80,000 Nebraskans who are unserved by broadband access. And while we started connecting them we think we'll get about 17,600 with the CARES Act money, we know that we've got more work to do. And this pandemic has really demonstrated the difficulty of working from home or education from home or telehealth or name any of the other really important functions that broadband access serves for our small towns and rural communities. And again, if we're going to invest and grow our small towns and rural communities, we've got to have that broadband access. So this is going to be an important bill for us to continue to grow the state of Nebraska. We'll also then have regular press briefings in the hearing room, 10 a.m. Wednesday next week, 10 a.m. Friday next week. So we'll pick up that regular schedule next week. And then, of course, again, just remind people with regard to the pandemic, please continue to, wash your hands often, keep that 6 foot of distance, wear your mask, avoid the 3 C's, and please, when you're having those symptoms like cough, fever, lost your sense of taste and smell, make sure that you're getting, staying home for that. And then the other thing I just want to emphasize as well is we have this treatment for with monoclonal antibodies infusion that is really effective in keeping people out of the hospital. And especially if you're in that older category of folks, if you are starting to experience the symptoms and have coronavirus, please see your doctor about getting that treatment, because it's been really effective in making sure we get people, and when we get it early, we got to get it early. So just when you get that sniffle, ask your doctor about getting that monoclonal antibody treatment, because we've been able to keep people out of the hospital because of that. And of course, that reduces our hospitalizations and overall increases the health of our state. So that's another great treatment we've got here in Nebraska. I encourage people to take a look at and get early, because it's only effective if it's done early. And with that, I'll go ahead and wrap up and say thank you to everybody. I appreciate it all. And everybody have a great weekend. Stay warm. Oh, I'm sorry. I should congratulate Omaha on getting the NCAA volleyball championships. That's really exciting news. So we're really excited to hear that as well. So congratulations to Omaha. Obviously, we've got great experience in hosting these types of events. I know it's going to be very successful. And with that, thank you, Taylor, for hosting us, and everybody have a great weekend. We'll see you next week.